Okay, picture this. You head out to the barn, maybe the pasture, and you see a bit of blood, maybe more than a bit, coming from your horse's nostril. That immediate kind of jolt, right? That, oh no, what's happened feeling? It's totally normal. Today, we're doing a deep dive into something that causes exactly that reaction: equine nasal bleeding. The technical term is epistaxis. And it's tricky because it can be anything from, a tiny little trickle you almost miss to something really serious, potentially even life-threatening.
Right. And our goal here today for you is to really break this down. We want to unpack the many possible causes behind it, look at how vets actually figure out what's going on, and then, crucially, talk about the treatment options.
Exactly. Think of this as your way to get up to speed quickly, to understand what really matters when you see this. We want to give you that clarity because in these situations, every second can feel like it counts. Okay, so let's start with that first mystery. You see blood coming from the nose. The immediate question is, where? It's not always simple, is it? The source is, like, the first big piece of the puzzle.
Yeah, what's really interesting is just how many places it could be coming from within the respiratory system. We're talking the nasal passages themselves, the sinuses, those sort of unique guttural pouches just behind the throat. And for performance horses especially, it can actually come all the way from the lungs.
Wow, okay, that's a big area. So how does a vet even start to narrow that down? Like, what's the first clue?
A really key early sign, probably the first thing they'll try to determine, is whether the bleeding is unilateral, just one nostril, or bilateral, coming from both. Unilateral, just one side, often points towards a problem, closer to the front, in the nasal passages or sinuses maybe. Bilateral from both nostrils often suggests something deeper. Could be the guttural pouches, the lower airways like the lungs, or sometimes even a systemic blood clotting problem.
Okay, that makes sense. One nostril versus two gives you a starting point. So knowing it can come from all these places, what are the actual reasons it happens? Let's get into the common culprits vets look for.
Yeah, we can sort of group these to make it a bit clear.
Okay, let's start with maybe the most obvious one. Trauma. Just, accidents. That's pretty common, right?
Oh, absolutely. Simple injuries are definitely high on the list. You know, bumping into things, getting kicked by another horse, a fall. These can easily damage blood vessels or even cause like small skull fractures sometimes. And it's not always dramatic trauma either. It could be irritation from tack that doesn't fit well or even like a splinter or a bit of hay stuck up there.
Okay. Then there's the one people might have heard about with racehorses, exercise-induced pulmonary hemorrhage, or EIPH, the bleeders.
Yes, exactly. EIPH. This is a really big deal in, equine athletes. Basically, during really intense exercise, tiny blood vessels in the lungs can rupture, and then that blood travels up and out the nostrils. An interesting clue here is that it often appears maybe 5 to 20 minutes after the horse stops exercising. It really highlights, the incredible stress these horses' bodies are under.
Right. Okay, moving on. What about ethmoid hematomas? They sound a bit mysterious.
They kind of are. They're these slow-growing masses, usually benign, thankfully. They grow from structures deep inside the nose called the ethmoid turbinates. The key thing here is they tend to cause this intermittent sort of reddish-brown discharge, usually just from one nostril. And weirdly, it can actually get worse after exercise, which seems counterintuitive but is characteristic.
Okay. Now for something that sounds much more alarming. Guttural pouch mycosis, GPM. You said life-threatening?
This one is absolutely critical. And yes, terrifying is the right word. GPM is a nasty fungal infection in those guttural pouches. The real danger, the truly scary part, is if that fungus eats away at the wall of the internal carotid artery. That's a major artery running right through the pouch. If that ruptures, you get sudden, massive, potentially fatal bleeding. It is a true lights and sirens emergency.
Wow. Okay. That is serious. Is there any warning, or is it just sudden?
It can often seem very sudden when the artery's involved. There might be smaller, earlier bleeds, but the catastrophic one can happen without much warning. Immediate vet intervention is the only chance.
Understood. Okay, bringing it back down a bit. What about more common stuff, like sinusitis and rhinitis? Just inflammation, can that cause bleeding?
It absolutely can. Simple inflammation or infection in the sinuses or nasal passages can make the lining irritated and fragile.
Right.
So, yeah, those blood vessels can break more easily. You often see other signs with this too, like pus, maybe a bad smell. And it's really important to remember, sometimes the root cause of that sinusitis is actually dental disease. So a nosebleed could point to a tooth problem.
Huh, interesting connection. Okay, and then there are the more, let's say, ominous possibilities, tumors and blood clotting disorders.
Yeah, unfortunately. Masses or tumors in the nose, sinuses, or even lungs can disrupt blood vessels and lead to bleeding, often recurrent bleeding. And statistically, a fair number of nasal and sinus tumors in horses, maybe around 68%, are malignant, which is obviously serious. Then you have the systemic issues where the horse's blood just doesn't clot properly. This could be due to various underlying diseases or even certain medications. You might see other clues then, like tiny red spots on the gums petechiae, or if they bleed for ages after a simple blood draw. That's when blood tests looking at platelets and clotting times become really important.
Are there any other, maybe less common causes? Things that might surprise us?
Well, it's less often the primary cause, but high blood pressure could make vessels more fragile. Even just really dry air can sometimes cause minor cracking and bleeding inside the nose. And sometimes other infections like strangles or even aspiration pneumonia might have bloody discharge if, say, an abscess bursts. Conditions like vasculitis, inflammation of blood vessels, or fibrous dysplasia, which is weird bone growth, can occasionally be culprits too.
Man, that is quite a spectrum. It really drives home the point, doesn't it? A nosebleed isn't just a nosebleed. It's a sign that something is wrong, and figuring out that something is key. Okay, so we've covered this huge range of potential causes. It really shows how complex this can be. So once the vet is there, how do they actually start figuring out which one it is? Let's get into the diagnostic detective work.
Yeah, you nailed it. Accurate diagnosis is everything because the treatment depends completely on the cause. Vets use a very systematic approach, kind of like solving a puzzle.
So what are the first steps? History and physical examination. What are they looking for right at the start?
Well, first, they'll talk to you, get a detailed history. When did it start? How long did it last? How much blood are we talking? What did it look like? Bright red, dark, clots, frothy. Then they'll do a thorough physical exam. Check the horse's overall condition, look for any signs of injury on the head or face, listen for weird breathing sounds. And like we said before, noting if it's one nostril or both, that unilateral versus bilateral thing, it's a huge early clue.
Makes sense. Then I guess you need to actually look inside. Endoscopy. That sounds like a go-to tool.
Oh, absolutely. The endoscope is invaluable here. It's basically a long, flexible camera that they gently guide up the horse's nostril. It lets them directly see the nasal passages, the openings to the sinuses, those guttural pouches, the larynx, even down the trachea towards the lungs. They can often pinpoint the exact source of the bleed, spot masses, see those fungal plaques in GPM, or find other issues. Sometimes they even need the horse to be bleeding slightly during the exam to see exactly where it's originating.
Okay, so direct visualization is key. What if they need more? What about diagnostic imaging, x-rays, and things like that?
Right. Sometimes the scope can't see everything, or they need a different view. X-rays of the skull are really useful for finding fractures or seeing if there's fluid like blood or pus trapped in the sinuses, or maybe detecting larger masses. Ultrasound can be used particularly to look at the lungs for signs of bleeding, like an EIPH, or fluid around the lungs. And then for really tricky cases, especially if they suspect a tumor and need to know exactly how big it is or where it's going, you have advanced imaging. Things like CT scans or MRI give these amazing cross-sectional images, like a detailed map inside the head.
And what about analyzing samples? You mentioned fluid clues and blood tests.
Yep. If they suspect EIPH or something else lower down in the airways, they might do what's called a BAL, bronchoalveolar lavage, or a tracheal wash. Basically, they flush a small amount of sterile saline into the airway and collect it back. Then they analyze that fluid for red blood cells or signs of infection. And blood tests are crucial too, checking for anemia from blood loss, signs of infection body-wide, and especially those specific tests for blood clotting problems if that's suspected.
And sometimes, I guess, you need an even closer look, more invasive maybe.
Exactly. If they see a mass with the endoscope, they'll usually take a biopsy, a tiny tissue sample. That gets sent to a lab for analysis, which is essential for identifying tumors, for example. And in some situations, maybe for stubborn sinusitis, or if they can't quite see a lesion well with the regular scope, they might do sinoscopy. That involves making a small hole through the bone into the sinus cavity itself, so they can insert the scope directly in there for a better look and maybe flush things out. So you see, it's this multi-step process. Each test builds on the last, narrowing down the possibilities until they arrive at the right diagnosis. It's all about precision.
Okay, so the detective work pays off. The diagnosis is made. We know what's causing the bleeding. What happens next? This is the crucial part, right? The action. How is treatment tailored to the specific cause?
It has to be tailored. There's no one-size-fits-all treatment because the causes are so different. That diagnostic step is non-negotiable.
And I'm guessing the absolute first piece of advice, the golden rule for any owner seeing blood, is basically keep calm and call the vet. Right.
Absolutely, 100%. Panic is contagious, and if the horse gets agitated, its blood pressure goes up, and that can make bleeding worse. So stay calm yourself, keep the horse quiet, and call your vet immediately, especially if it's heavy bleeding. If it doesn't stop, if it keeps happening, or if the horse seems weak or has pale gums.
Hmm.
And this is critical, a huge do not. Do not try to stuff anything up the nostril to stop the bleeding.
Oh, right. Why not?
Because horses have to breathe through their noses. They're obligate nasal breathers. If you block their nostril, they can't breathe properly and they'll panic, which is dangerous.
Okay, that's really important. Don't pack the nostril. Keep them calm. Maybe stall rest. Call the vet. Got it.
Yeah, and sometimes sedation might even be needed if the horse is really worked up.
What about the less scary scenarios? Simple solutions for minor bleeds. If it's just a trickle.
Right. Not every nosebleed is a five-alarm fire. Small bleeds, maybe from bumping their head or dry air, might stop on their own. Keeping the horse calm and quiet is usually enough. Sometimes gently elevating the head might help slow the flow. And weirdly, letting them eat off the ground can sometimes help drain any remaining blood out rather than having it go down their throat. Occasionally, a vet might prescribe antibiotics just as a precaution because blood sitting in the airways can be a good place for bacteria to grow.
Okay. Now back to the big emergency. Urgent interventions for guttural pouch mycosis. What's the plan there?
Yeah, GPM with arterial bleeding is life or death. The standard approach is emergency surgery. They need to surgically tie off or ligate the damaged artery to stop the hemorrhage immediately. Then they treat the underlying fungal infection, usually by flushing the pouch directly with antifungal drugs. This is definitely complex surgery, usually requiring referral to a specialized hospital. Time is absolutely critical.
Right. And for managing EIPH, you said there's no cure, just strategies?
That's correct. We can't cure EIPH, unfortunately.
Hmm.
So management is about reducing how often it happens and how severe it is. Strategies include things like adjusting training intensity, maybe less strenuous work, and the medication furosemide, or Lasix, is commonly used, especially in racehorses. It's a diuretic that helps reduce blood pressure and fluid in the lungs before intense exercise. Good stable management, like ensuring really good air quality and ventilation, can also help manage respiratory health overall.
Okay. And what about treatments for those other things, like sinusitis or tumors?
Well, for bacterial sinusitis, it's usually antibiotics, sometimes combined with flushing out the infected sinus. And if, remember, dental disease is the underlying cause, then fixing the tooth problem is paramount. The sinusitis won't clear up until the dental issue is resolved. Fungal infections need specific antifungal meds. For tumors, treatment really depends heavily on the type of tumor, where it is, and whether it's spread. Options might include surgery to remove it, radiation, or chemotherapy. The prognosis varies a lot.
And if the diagnosis was one of those systemic blood clotting issues?
Then treatment focuses on managing that underlying condition. This might involve giving the horse fresh plasma transfusions to supply missing clotting factors, or specific drugs like corticosteroids for immune problems affecting clotting, or vitamin K1 if it's something like warfarin poisoning. It's very targeted medical management aimed at restoring the horse's normal clotting ability. Things like heparin or aspirin might be used carefully in some clotting disorders like DIC to prevent complications. For pulmonary edema, furosemide and respiratory support are key.
And finally, what if there's been really severe blood loss? What are the emergency measures?
If a horse has lost a lot of blood quickly, the immediate priority is supporting their circulation with intravenous fluids, usually crystalloid solutions like saline. But it's a bit of a balancing act. If the bleeding isn't controlled yet, pushing too much fluid can actually increase blood pressure and worsen the hemorrhage. If the blood loss is severe enough that the horse doesn't have enough red blood cells to carry oxygen, say, they've lost maybe 30% or more of their blood volume acutely, then blood transfusions become necessary. That's a life-saving intervention.
Wow. What an incredibly detailed journey we've taken. From that first, often scary sight of blood, all the way through the potential causes, the meticulous diagnostic process, and finally the very specific, tailored treatments. It's really quite something.
It absolutely is, and it really hammers home the point. If you see significant or recurring nasal bleeding in your horse, get your vet involved promptly. The outcome, the prognosis, really hinges on figuring out that underlying cause and treating it appropriately. And sadly, yes, severe fatal bleeding is a real risk if a major artery is involved, like in GPM. It's also really important for owners, while waiting for the vet or during treatment, to help monitor things like the horse's gum color, heart rate, and general hydration status. Those are vital signs.
This whole deep dive really makes you appreciate how much our horses' bodies can signal when something's wrong, even through something like a nosebleed. For you, listening, we really hope this gives you not just information, but a deeper sense of understanding. Moving past just knowing what to do to really grasping why it's being done.
Hmm.
That appreciation for the complexity is key.
And maybe it makes you wonder, what other, perhaps more subtle signs are our horses showing us all the time? What else are they trying to tell us if we just learn how to look and listen and connect those dots?
Something to think about. Keep exploring, keep learning with your horse, and thanks for diving deep with us today.